I'm thinking about getting lip fillers, but I'm scared of something going wrong and I want to see what the procedure actually looks like. I'm Dr. Abs, and I've got you covered. This is my lovely patient Sarah, who very kindly let me use this video for you all. She said she wanted her lips to generally look a little bit more full and more defined on her borders too, because that border definition actually was lost in previous filler treatments that she had. So remember that. You can lose lip border definition depending on the lip filler technique that you use. Now, the filler specifically that we used here was this, RHA Kiss by Teoxane. Is it the best lip filler out there? Absolutely not, because there's no such thing. What's best for you is going to be completely different to what's best for someone else. But here we chose it because it's soft enough to replicate the lip density, it's flexible enough to move with the lip without breaking through the skin, and at the same time, it's strong enough to support its own structure, so that wherever I place it, I know that that part of the lip can be propped up well. Now, the instrument that I chose to inject with was this, a needle. Now, again, is the needle the best instrument for lip filler out there? No, definitely not. It depends on what lips you have and what lips you want that determines the tool you use to get there. Just like on a sat-nav, depending on where you are and where you want to get to, you're going to find a particular route to get there. Generally, it's either a needle or a cannula. In this case, I wanted to be so precise with my positioning with the filler that I just had to choose a needle. It's a precision instrument. Cannulas are like a butter knife, spreading butter very evenly on toast, and needles are like, say, a toothpick, getting a very, very tiny dab of butter, putting it in a very, very precise location. The volume we chose to inject here was 0.5 mils, because she already had, as you can tell, quite good volume in her lips, and she only did small tweaks in certain areas. And actually, to that end, I'm going to pause for a sec. I'm going to be completely honest with you. I think if I used more than 0.5 mil in this particular case, I would have made her really unhappy, because so many of my patients say to me when we first meet, especially, if they've never had lip fillers before, so they don't know what to expect, that they do want their lips changing or filling, but at the same time, they've been hesitating to do it for so long because, well, they're scared. They're scared they're going to come out of the treatment with these botched lips that people can spot from the other end of the room, and they'll point and laugh at them, that newspapers are going to write stories about them, horror stories about them. And honestly, I get it. I really do. I completely understand where they're all coming from, and in this particular case, I stopped that risk by being just so careful and precise with my planning and execution. So make sure that you also go to someone able to do the exact same for you. So RHA Kiss, needle 0.5 mil, that's the easy part. The difficult part is planning the placement. Listen really carefully. This is the most important aspect of your entire treatment. Any idiot can learn to push the plunger on a syringe, but where, which angle, how much, which anatomical layer you to aim for depth, these are the aspects that make the difference between happy patients that get what they want and botched faces filled with regret, misery, and embarrassment. So here's how I did it. You can see in this picture of Sarah next to a lip diagram that Sarah's missing what we call the Cupid's bow, that M shape that you see at the top. And those two peaks of the M's are called GK points, Glogau-Klein points. She also didn't have very much volume on the very, very ends of her lips, what I call the tails. And the lower lip was sort of the border was kind of like a U shape instead of the middle third being a bit flatter like you might find in nature. So these are the areas that we're interested in making subtle changes to. And now we know the two-dimensional position of where we want to inject. The next step is to decide the depth of the injection so that we have a three-dimensional plan. So let's take a look at which layers are available to us here. What you can see now is a cross-section. You can see the jawbone and the teeth sat behind with the lip in front. And within the lip itself, we can see a full thickness cross-section with all its layers. The skin is at the front, and the skin touching the teeth on the inside is called the mucosa. Between these two are the injection zones, the deep fat and the superficial fat, which is closer to the outside. In between, we have the lip muscle. Now, I chose to inject here into the superficial fat because it allows us to change the shape, but without projecting the lip too far forward at the same time. No one wants to look like a duck now, do they? As well as this, look carefully at the placement of the blood vessel here. Most of the time, but not always, it's in the deep fat. Now listen very, very, very carefully. If you don't want to risk losing your vision and going blind, never, ever, ever inject filler into a blood vessel. If you block the vessel, then you block oxygen flow and things start to die off. People have literally gone permanently blind from fillers blocking blood vessels. So by staying in a superficial fat, I reduce that risk as close as possible to zero. Now, as scary as that sounds though, luckily, it's a risk that can be controlled very well if your doctor knows what they're doing. So just make sure you go to someone qualified, like myself for instance, and you can ensure that you're being treated safely because they know the relevant anatomy of what they're injecting into. But for now, we know what we're injecting, how much, and our 3-dimensional plan as well. If you're serious about having this treatment, then please understand that this is the level of planning that must be done if you're gonna have this treatment done safely. Other doctors might do it in a slightly different way, in their own way, which is fine, but you still need to figure out the same bits of information regardless of how you get there before you inject. Ask your doctor if they can give you these bits of information before they start, and you can be sure that they know what they're doing. And with that, it's time to inject. Here, I'm simply marking out with a pencil where I'm going to place my needle. And then I'm demonstrating how that can turn the lower lip outwards to give the effect of making the whole lower lip look bigger, but without injecting into every single part of it. I'm now injecting exactly where I've marked out. The needle is going through the border and into the body of the lip. I'm advancing the needle very, very slowly because I want to maintain its depth in the superficial fat. And when I get to the right place, I'm injecting the filler as I slowly retreat the needle backwards. But I'm not going to pull out completely. Just before I get to the end, I'm going to go back in with a slightly different angle to create a type of A-frame that can support the border where I want it to be supported. This is a technique that I used in all the areas that we marked out in this case. If we freeze the video here, we can actually see where I've used the technique in particular areas of the top lip where we've marked out, from where it's slightly red as part of the plan. What I also want you to do here is see exactly how defined that Cupid's bow is now compared to where we started. Some people will say that results like this are photoshopped, which I take as a very big compliment, so thank you. But as you can see now, with it being done in real time on video, not only is it completely real, if you also go to someone capable of planning it like we have today, you can have it too, just like Sarah, who chose to see me specifically. In fact, if you're in the UK and you'd like to come see me, just drop me a message on Instagram and we'll go from there. Now, the style or final look may not be to your individual taste, but that's absolutely fine. Everyone's different, everyone likes different things. But the important thing here is that we figured out what individual style she wanted.
It's Brittany, bitch.
And gave her exactly that while staying safe the whole way through the treatment. The lifespan of the filler in this case is probably going to be a few years, and lifespan of the border definition is probably going to be a little bit less, simply because of the amount that we move our lips every day. Now, a genuine word of advice though, if you're looking to get your lips filled, so please listen. I've had the absolute privilege of so many patients over the years choosing me specifically to treat them, and I always like to ask them what kind of advice about lip filler they would give themselves if they could go back in time before their first treatment and speak to their younger selves. What makes this so interesting for me is that even though everyone's different, the same pieces of advice are said again and again and again. And I've compiled these most common ones into a single short list. So before you get injected, do yourself a favor and give it a watch afterwards. Learn from the wisdom of those that have been there before you and already had done what you're thinking of getting done. Otherwise, thank you so much for watching, and subscribe if you want more.